Well, it's a few minutes after 8. Thank you for staying with us. Tutwan is still alone. My partner in news, Gareth Edwards, only joining us, of course, well, at least from tomorrow and, of course, days after that. But let's start here. This hour, the announcement of a booster Pfizer shot for COVID-19 has been widely welcomed. The South African Health Products Regulator had announced yesterday that it has approved the administration of a third shot, and this will happen at least 6 months after the second vaccine. The Health Department's Acting Director General, Nicholas Cripps, joins us now with more details on this. Dr. Cripps, good to have you, and thank you so much for your time. We are here where we're seeing SAHPRA approving that Pfizer booster shot. So let's talk more about this booster shot rather than what it entails. At least so far, what do we know, besides the fact that if you took your second jab, you can only take your booster now at least 6 months after your second one?
Morning, Tamela. So first, the good news is that I'm not the Acting Director General anymore because we welcomed our Director General back to work, and so I'm the Deputy Director General in the department. But let's talk about the boosters. I think what the public need to know is that SAHPRA is one step in a process. So indeed, SAHPRA is the regulator, and they do evaluate whether whatever medicines and the schedules for medicines are going to be approved for use. But you'll recall that they, more than almost 2 months ago, approved a 2-dose schedule for administration of to children, and yet we did not implement a 2-dose schedule at the start, and we only approved 1 dose. And that because there's a separate process where the matter goes to the Ministerial Advisory Committee on Vaccines. They consider other evidence, and then it gets an advisory gets sent to the minister. And depending on how the minister discusses with us in the department and we with the provinces and the private sector on the logistics of the implementation, that is what actually dictates it. So there are lots of steps. But having said that, yes, the ruling so far is that a Pfizer vaccine will be allowed to be administered to people who have had their primary schedule of Pfizer vaccine after an interval of 6 months. And that means that the first people who will qualify will be around about the 28th of December. And since that is in the middle of the Christmas period, it's unlikely that we will have time to do the training and change the systems to happen a couple of days before New Year. So it's more likely that if we get a decision and a recommendation from the Ministerial Advisory Committee, it will be in early January. So that's on the Pfizer vaccine.
Absolutely. And Dr. Cripps, apologies for that title mishap in the beginning there. But let's also talk about, the age groups here in terms of administering, the Pfizer shots. In my understanding, please correct me if I'm wrong, in terms of those who have weak immune systems, that administration, I understand, might be a bit different.
Yes. So there's a difference between a booster shot and an additional shot. So for most of us who have a normal immune response, what we do is we give a primary schedule. And in the case of the Pfizer vaccine, it's always been 2 doses. And in our country, we give them 42 days apart to give your body a chance to make immunity and get a good, solid immunity. And then a booster shot is where, at a period when your own immune system starts to reduce, we call it waning, then we give them another stimulus of the same protein to get the vaccine, in the vaccine, to give an increased immune response. But for people who don't make adequate immune responses, and those are people who are on steroid therapies for transplants, some people on cancer, who are receiving cancer treatment, HIV patients who haven't responded to their treatment yet in particular, and primary immune deficiency. So there's a range of conditions. Those people have suppressed immune systems, and they are what we call immune compromised. And so for them, it's not a booster dose. We don't wait for a long period. We now give them an additional dose as part of their primary schedule, and that is given 28 days after the second primary vaccination. And for that, they need a request form that comes from a doctor who's looking after them.
Dr. Crisp, I mean, we're sitting, I think, at approximately, 25% of those who've been vaccinated in terms of our population in South Africa. I mean, I'm not sure if that number has just increased, but if it has, I'm sure it has increased very slightly. Are you confident that, you know, people will come for this booster or even additional shot, given that this is where we are right now with the initial vaccinations and vaccines so far, whether it's Johnson & Johnson or even Pfizer?
So, Tamela, so first of all, it's not 25%, it's way more than that. In terms of first dose vaccination, adults is already 50%, or close to 50%. So it's a completed primary schedule where it's sitting at about 37% of adults, but remembering that the younger adults have not had as much time to get vaccinated as the older people. In the age group over 65, 65% of people have had at least one dose. So it very much depends on the age category we're looking at.
Right.
And it's younger people who have not come in the necessary numbers. But having said that, the question of boosters, first of all, we need to get more people to get primary immunity. So the pressure is to get a larger number of people who've never been vaccinated before to come forward. The biggest concern is always with older people and those who are living in what we call congregate settings, old age homes and so forth. That is where we really want to vaccinate people because of the greatest risk. Then we would like the whole population, including younger people and including adolescents from 12 to 17, to be vaccinated. Then there's the booster dose. And those are for people who are already committed, already been vaccinated, already understand the value of vaccinations. And the vast majority of those people, because they understand and they know, we believe will come back for their booster doses. Many of them are the ones who are pressing us all the time and want to come for boosters. So we're glad we are going to be able to offer that service at the appropriate time.
Yeah, and Dr. Crisp, I think you've just explained it very well, just in terms of understanding and simplifying it per age group, in understanding that where the challenges lie, and young people are still encouraged to go and get their vaccines. But as you mentioned, their primary, vaccines important, of course, before we can even get to this stage of boosters. But I appreciate your time this morning. The Health Department's Dr. Nicholas Crisp, thank you so much for joining us right here at the South African Morning.